Good day to you. My name is Chelsey. Nice to be here with you today. And yes, we are in my washroom, which is kind of random, but it's not random at all. Today, I'm going to share with you one of the post-surgical scar maintenance techniques my reconstruction surgeon gave me because I believe it worked like magic. So today I'm going to share with you what it was, how to do it, and you can decide if you'd like to add this into your post-surgical routine or not. So let's backtrack a little bit. Prior to surgery, I spent a lot of time honoring my body and just really loving on it. And coming into surgery, something that was just really irking me was the fact that I had to remove a part of my body that was mine. And something that was really important to me was nourishing my body post-surgery to just help maintain as much of me as possible. So when I heard about this scar management, reducing of the scar technique, I went all in on it. So I'm going to share that with you today. But before I show you exactly what I did, I do want to say, first and foremost, listen to the recommendations of your own surgeon. I am not a surgeon. My surgeon is not your surgeon. So I'm just sharing my experience with you. If this is something that interests you, perhaps talk to your surgeon about it and see what their recommendation is. But first and foremost, I say listen to your surgeon. So it is actually quite easy. And what it is using a post-surgical tape. This was recommended to me by my surgeon to be put on after the stitches were removed. So for me, that was about 2 weeks after surgery. So this is something that's after the stitches are removed. What she recommended that I did was use this post-surgical tape and put it over my scars and continue to do that for 3 months. And that may seem like a long time, and it is, but I actually decided to take it a step further and do it for 4 months, because why not? It was really, really easy to do. I was recommended to leave them on for as long as possible until they got too ratty from the shower, and then just change them out. It's recommended to shower with them on, and after I come out of the shower, just dab on the post-surgical tape. And when they needed replacing, just replace them. But she said weekly, because if I were to do that daily, it would start to irritate the skin. And I do have to tell you that I am so, so happy with the results from doing this. The scarring from my mastectomy surgery is pretty much the same color as my natural skin. It's not raised, it is not red, and I was really, really happy with it. So that's why I wanted to share it with you. Okay, so on here it says micropore, post-surgical tape. I got this from the doctor's office where I had my surgery reconstruction follow-ups, but I also found it in just a regular pharmacy right next to where all the bandages, band-aids, and surgical supplies are. And the other side says hypoallergenic and 3M. So all I did was rip off a piece of tape, and I would be naked at this point. I would not have clothes on, but I'm not going to do that right now. So we're going to pretend that this is going on my bare skin. So my surgery, my scarring was over here. So I would simply just put it right along my skin, push it right on there, and then get more. I would overlap them. And this didn't hurt at all. Like I said, I waited until after a few showers, the tape got a little bit worn and it wasn't sticky anymore, and then I would take it off and it didn't bother my scars at all. So then I would do another one. Scar continued there, and one more here. So that is what you do. You put it on the skin, and yeah, like I said, I was really happy with it. I do have another surgery coming up one day, and when I do, I will be doing this because I feel like it made a really positive difference in my scar healing. It made me feel good that the scars were always covered. So when I had my post-surgical bras on and my bras on after that, it wasn't rubbing on my scar. It was always protected, which I think was a big part of the healing in my personal opinion. So I hope this is helpful for you today. I wish you all the best in your surgery. If you enjoyed the video, give it a thumbs up. And if you'd like to join again next time for more insights, tips, things that related to my breast cancer experience that I think might help you, or at the very least, help you feel less alone, subscribe. Thank you again, and we'll see you next time.